So in general, there are two forms of fiber in the diet. One is the polysaccharides, the starchy type fiber that is common in potatoes and rice and pasta. And the other is the undigested food that we eat. You might refer to it as twigs and branches and leaves, generally uncooked vegetables, fruit, especially skins on the fruit. Roughage is important to our colon because the colon moves the stool along by coordinated muscular contractions called peristalsis. And healthy peristalsis depends on a bulky stool. The colon generally has to have something to work on. It has to have something where when it squeezes, the stool moves along because the squeeze effectively propels it. So if we don't have a lot of fiber in our stool, the stool will be small and the colon's going to have to squeeze a lot harder to move that stool along. That's going to make us predisposed to cramping and to bloating and to just a bad digestive experience. And so fiber is very important for colon transit. The amount of fiber that's ideal for our colons tends to vary from one colon to another. An amount of 30 grams a day has been mentioned quite frequently. But it's a little bit misleading because what's enough for my colon may not be enough for your colon, or what's enough for my colon may be too much for your colon. So the symptoms of too much fiber are bloating, cramping, and frequent bowel movements. And the symptoms of too little fiber are small volume, hard stools that are difficult to pass and don't pass very frequently. So what we're looking for, each one of us, is something that's in between those two extremes. And I tell my patients to titrate the amount of fiber they take to what their colon wants. So to pass 1 or 2 well-formed solid stools easily per day is the ideal, without straining. And however we reach that means that we're giving the colon the right amount of fiber.